Hello, everyone. My name is Kendall Ho. I want to do an informal welcome to you first. You may have heard a little bit of a barking background because my dog also would love to welcome you. But thank you so much for being here. We'll be starting in about half a minute. So please enter and in about half a minute, we'll get started. Thank you very much, everyone. All right, I think we'll get started. Again, happy Friday, everyone. Thank you so much for being here. My name is Kendall Ho. I'm, for many of you, we have become old friends. Thank you so much for coming. And also for many of you are new friends. Again, I want to, on behalf of the Vancouver Coastal Health Indigenous or Aboriginal Health Unit, and also Intercultural Online Health Network, like to welcome you to the VCH Icon Indigenous Health Round. I would like to first do a land acknowledgement. I would like to acknowledge that this session today is occurring in the shared, unceded, ancestral, and traditional land of the Musqueam, Squamish, and Tsleil-Waututh nations. And as usual, I welcome you to do your land acknowledgements on the chat. We'd love to see where you're from, and your acknowledgement would definitely welcome that. And if you look at the bottom of the screen, click chat. Love to be able to see you. And that's also the location where we'd love to have you ask questions, make comments throughout the session as we move forward. We have a very exciting lineup. Really appreciate the excellent speakers that we have. But before I do that, I would like to welcome Elder Roberta Price. I really want to thank Elder Price to be here. She is giving us the opening prayer. Roberta Price is of Coast Salish heritage and is the elder advisor and research partner at the University of British Columbia School of Nursing, and have really strong ties with our Vancouver Coastal Health and also with the Aboriginal Health Unit. So Elder Price, thank you very much for being here. Let me pass the time over to you for the opening prayer. Okay, maybe what I'll do is, if people don't mind, maybe I will switch a little bit. Maybe I'll ask Lindsay Arscott. Lindsay is a Ministry of Health Director in the Patients as Partners program. And many of you are also familiar with Lindsay. I'm very glad to have Lindsay back today. And again, offering opening remarks and welcome remarks from Ministry of Health. Lindsay?
Great, thank you, Kendall. So thank you for the opportunity to provide some opening remarks and a welcome for today's Indigenous Health Round. As Kendall said, I'm Lindsay Arscott. I'm the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. And I'd first like to start by acknowledging and offering my deep respect and gratitude to the Lekwungen-speaking peoples on whose traditional unceded territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanic peoples whose historical relationships with the land continue to this day. I'd also like to acknowledge the Métis Charter community here in Victoria. So Patients as Partners believes in really that what we can make the health system better, we can do that when we involve patients, their families, healthcare providers, and community organizations, all working together in partnership. Our patientsaspartners.ca website has resources and a calendar that describes free educational events, such as this one, and also ICON's Multicultural Chronic Disease Management event, which is this weekend, that can benefit your patients and your families. So check out that website if you're interested in other educational events. Patients as Partners has collaborated and funded ICON for over 10 years with Dr. Kendall Ho as the executive director for all of that time. So when he mentioned we have a strong relationship and we've been fast friends, that is true because it's been over 10 years. Kendall came to Patients as Partners with the idea of providing educational events and forums to discuss incorporating traditional Indigenous healing into Western medicine. And really since that time has been very successful in bringing people together for discussions such as this one today. So I'm really honored to be here. Additionally, we're really honored to be able to collaborate with our participant organizations, including the First Nations Health Authority. Today's discussion, I feel, will be really relevant to what our new normal is in healthcare now, given the pandemic. And so that's where virtual care has really become a way of accessing healthcare that prior to the pandemic was not the norm. I hear my mom talking about her virtual care visits, and before the pandemic, that would never have been something that she has spoken about. And so I think really looking forward to hearing from the speakers today on how virtual care can be provided in a culturally safe way to Indigenous peoples and their families, and really learning more from our presenters. So thank you very much.
Thank you so much, Lindsay. Really appreciate that. Let me now check. Elder Price, can you hear us? And how's your connection now? Okay. There may still be some technical issues, perhaps. Elder Price, let me just check one more time. Okay. Maybe what we'll do is momentarily, I'm going to invite Laurie to have her opening remarks to welcome you all on behalf of the VCH Indigenous group, and also introduce our speakers. And maybe Laurie, after you introduce our speakers, we'll see if Elder Price is connected at that time, and maybe we'll have the prayer at that time, and then we'll go right into the discussion. Before I introduce Laurie and welcome her, I'd like to also acknowledge not only with Ministry of Health supporting us, and also really a tremendous partnership with Vancouver Coastal Health Indigenous Health units, together with First Nations Health Authority. We also want to acknowledge Vancouver Physician Staff Association for their support of this event. So we're very, very grateful for that. And with that, let me pass it over to Laurie. So Laurie, thanks for being here.
Thanks, Kendall. Good afternoon, everyone. So happy and grateful to be invited to open this session. My name is Laurie Quinn, and I am from the Dakota Nation in southern Manitoba on my mother's side, as well as English, Irish, and Icelandic on my father's side. I'm in my most honored role as auntie. I'm a daughter, sister, niece, friend, and colleague. I am the Director of Indigenous Patient Experience, Professional Practice, and Quality at Vancouver Coastal Health with the Indigenous Health team. I am grateful to be working in close partnership with Kendall Ho and his team in this work with the Icon Rounds. It's been incredible to see its growth and all the interest in it. Today, we will be listening to a presentation on culturally safe, quality virtual health care for Indigenous people. Virtual care allows Indigenous people to access care almost immediately while being able to stay connected with their home communities and avoid unnecessary travel and separation from their families and supports. The fact that this technology can connect patients and families to care providers in a safe way builds trust within the health system and offers equitable access to primary care despite the challenge of geography that BC has. Access to healthcare was highlighted as a challenge or problem within the In Plain Sight report. And I'm so excited to hear how First Nations Health has taken this work to the next level to transform access to care for Indigenous people. So with that, I will welcome Jon Rabeneck and Laura Baracaldo on their presentation after we check in with Elder Roberta.
Thank you, Laurie. Elder Roberta Price, are you able to connect with us? And Elder Price, I'm not hearing you at this point. And by the way, I really want to thank the 314 people here already. So this is amazing. So I'm rapidly scanning through and look for Elder Roberta. Unfortunately, her line is still kind of having a bit of a jumping up and down. Perhaps what we'll do is we will proceed, and I will communicate with Elder Roberta in between. So I would love to have Elder Roberta joining us and sharing her prayer with us at some point during this round. And so why don't we go ahead and proceed? Before I do that, I really want to thank all of those people who have put in their acknowledgement already on the chat. Thank you so much. Love to continue to see that. And also throughout the discussion, if you have any questions, comments, please put your comments onto the chat box. And so with that, I would love to pass it over to Jon and Laura. Jon, I've met again, worked with him for several years now in the past with Vancouver Island. And Laura, very, very exciting what she's setting up. And I think you'll be amazed at the virtual care that First Nations Health Authority is working on. And looking forward to this discussion. So Jon and Laura, let me pass time over to you right away.
Great, thank you, and thanks. Good morning, everybody. Good afternoon, everybody. My name is Jon Rabeneck. I'm Coast Salish from the Snuneymuxw First Nation on my mother's side, and English and Irish on my father's side. Coming to you today from beautiful Tsailt territory in the Saanich Peninsula here in the Greater Victoria area. And I work here at the First Nations Health Authority as the manager of virtual health and wellness services. That's my introduction. We'll be sharing some information today on culturally safe, quality virtual healthcare for Indigenous people and their families. But I'll pause for a moment just to introduce Laura.
Thank you, Jon. Good afternoon, everyone. My name is Laura, and I am an uninvited guest and settler on this land. So I'm speaking to you today from the unceded lands of the Katzie people, also known as Maple Ridge in British Columbia. And I'm extremely grateful to be able to be on these lands and have my family here and my work. And thank you so much for the opportunity to speak to you today about our program and our initiatives and how we're trying to do better to show up for our families and our communities. So thank you.
Great, thanks, Laura. So we have a bit of a PowerPoint presentation here, and there is a multimedia aspect to it as well. So I'm going to do my best to share audio and make sure we're all on the same page there. If there's any issues or something, please, I'll defer to some of our other chairs to chime in and let me know right away so we can tackle it. But if that's all right, I think if folks can see that, then we can get going here. So here we go. So just a bit of an overview today. So we provided our introductions. We'll provide some context of the First Nations Health Authority and how this work came to be and where we are today with our perspective on health and wellness. We'll provide an overview of our virtual health services. So our two virtual clinics, our Doctor of the Day and our Substance Use and Psychiatry. And just to note, I think we're sort of in the zone sometimes when we say DOD or DOD, and we'll say SUPS to refer to each of those clinics. And just to note, those are referring to the Doctor of the Day and the Substance Use and Psychiatry, respectively. We'll provide an overview of the medical office assistant role within the program, as well as our mental health care coordinator role as well, which Laura is one of. And of course, provide some open dialogue at the end. So really encourage folks to put in some questions in the chat. And of course, our contact information will be there at the end as well. So if folks want to have a follow-up conversation. So the First Nations Health Authority embodies the perspective of First Nations perspective on health and wellness here, with this visual representation here showing that. So the expression showing the First Nations perspective on wellness, the way it has always been passed down from our elders and our traditional healers, with the understanding that wellness belongs to every human being, and the reflection of this perspective would be unique to each person. So the center circle there that you see representing the individual human beings, really noting that wellness starts with individuals taking responsibility for our own health and wellness, whether we're First Nations or not. And the second concentric circle coming outwards, illustrating the importance of the mental, emotional, spiritual, and physical facets of a healthy, well, and balanced life. The third circle there representing the overarching values that support and uphold wellness, so the respect, wisdom, responsibility, and relationships. All other values are in some way essential to the other four there. The fourth circle depicting the people that surround us and the places from which we come. The land, community, family, and nations are all critical components to our healthy experiences as human beings. And the fifth circle there depicting the social, environmental, cultural, and economic determinants of our health and well-being. And of course, the outer circle there being the people who make up the outer circle, being our children, families, elders, and folks in communities. These people are holding hands to demonstrate togetherness, respect, and relationships, which in the words of a respected BC elder could be stated as one heart and one mind. Children are included in the drawing because they are the heart of our communities and they connect us to who we are and to our health. So the First Nations primary care design and delivery is rooted in an approach of culturally safe primary care with high quality and relevant care closer to home. The transformation of primary care through the active implementation of the Declaration of the Rights of Indigenous People, as well as the First Nations-led design and delivery of primary care.
Okay, thank you, John. So FNHA is really trying to do things differently and kind of working within a system that we know has quite a bit of barriers and limitations. So it is important to contextualize our work and what we're doing, and knowing that although we're trying to do things differently, there is systematic barriers, and there is such thing as still like racism within our healthcare system. I'm sure many of us are familiar with the Plain Sight Report, which was released in 2020. And although it highlights things that we have done well and things that we have improved, there's still many, many things that we need to address. So we are well aware that prejudice and racism against Indigenous peoples have deep roots in colonial beliefs, and that many times these beliefs were considering Indigenous people are being worthy of care, less worthy of care, that they were incapable of like taking care of themselves, and that wellness wasn't something that was important to them. And so on these beliefs, we have built a whole system that we've been trying to work through and trying to implement things to make sure that our families are feeling supported despite the system that we work with. So it's very, very important that we not only see this as like a one-on-one support, but that we see this as a system situation, and that FNHA is working and is aware that this is a part of the work that we do. Next slide, John. Thank you. So with that context and that systematic piece in the back of our heads, we move into understanding that there's also things that are going on that make our jobs challenging. And that was when we were facing that dual public health emergency, which we're continuing facing to this day. So we are all well aware that the dual public health emergencies of the overdose crisis and the pandemic have impacted all of our lives, families, and communities, and that this had a particularly deep effect on BC First Nations and their communities. So early in the pandemic, healthcare operations and support services in a number of communities were reduced or closed. While most have since reopened, since restrictions have been lifted, there are still many that are working under very temporary restricted access. So FNHA noticed this, and as an urgent response on April 1st, we launched the First Nations Virtual Doctor of the Day program, which was to provide support to First Nations living in British Columbia who were not able to access primary care. And alongside the pandemic, we were also dealing with devastating increase in the rate of overdoses and deaths in British Columbia. So both the overdose and as well as the pandemic were disproportionately impacting First Nations communities. So with DOD, we realized that people were accessing it and we were being used by community, and it was great, but a lot of it was utilized for mental health services as well as substance use. So based on the feedback from community, from elders, and from professionals as well, we were asked to create a program that focused on the mental health piece and then the substance use piece. So from DOD, we created the First Nations Virtual Substance Use and Psychiatric Service to serve that part that was a high need. So we were in constant communication with communities and really understanding the need, and then we deliver this program. Next slide, please. So just to provide you a little bit of more context with DOD, we have Dr. Kelsey Louie, who's going to tell us a little bit about DOD and how it works.
Hello, my name is Dr. Kelsey Louie, and I'm here to tell you about a new program called the First Nations Virtual Doctor of the Day. It's a way for people with limited or no access to a doctor to see a doctor using their phone, tablet, or computer. It's a service for First Nations people who either don't have a primary care provider or who can't reach their regular provider. All First Nations people who live in BC are eligible for this service, and so are their family members, even if those family members are non-status. Our program includes doctors of Indigenous ancestry and doctors who are trained to follow practices of cultural safety and humility. The First Nations Virtual Doctor of the Day program is easy to use. You make a phone call and schedule a visit. A medical office assistant will answer the phone. Make sure you have your status card or your personal health number ready. It's best if doctors can see patients over video chat, but if you don't have access to a computer or an internet connection, then you can still arrange a telephone appointment. To see a doctor on video, all you need is an internet connection, a laptop, smartphone, or tablet with a built-in microphone, and a headset or earbuds, especially if you can't find a private space for your video call. The medical office assistant will schedule a doctor's appointment on a popular video conferencing app called Zoom. If you've never used Zoom before, don't worry, it's easy to use. Here are some tips about using Zoom on your computer or laptop. Your medical office assistant will send you an email that has a link. Click this link and it will start Zoom on your device. Once Zoom is open, make sure your microphone is turned on. We recommend using a headset or earpods. This keeps the audio clear and protects your privacy. Using Zoom on your phone is easy too. Just download the Zoom app from the App Store or Play Store. Check your email on the phone to find the invitation link. From there, you take the same steps with your microphone and your headset. If you already have a doctor, then we encourage you to continue with that doctor. This will help those who don't have a doctor to get the help they need. If you do not have a doctor, or you cannot connect with your usual care provider, please call toll-free to book an appointment at 1-855-344-3800. The First Nations Virtual Doctor of the Day service operates 7 days a week from 8:30 a.m. to 4:30 p.m. To learn more about the program before making an appointment, visit fnha.ca/virtual doctor. We look forward to hearing from you. Thanks for watching and stay healthy.
Okay, thank you so much, Jon. So just to kind of reinforce a little bit what Dr. Louis mentioned, we have a graph here to help us understand a little bit more about each program or each pathway. So on the left side, we have the Doctor of the Day, which is a primary care service, and we have family practice GPs. The program can be accessed by self-referral, and it works 7 days a week. And we can use Zoom or phone. Really, the doctor will meet you where you're at. If you don't have the technology, the pathway sometimes the program is able to support you with connecting with the technology. And we'll talk a little bit about that in a little bit. But yeah, we find ways to do that. And once again, it was launched in April 2020 as a response to the dual pandemic with COVID and the overdose. And on the right side, we have the Psychiatry, First Nations Virtual Substance Use and Psychiatry Service. So this is a specialty service. It's for addiction medicine and psychiatric. And the referral is can be accessed through any health professional or wellness provider. So these can be a social worker, it can be a nurse practitioner, it can be an elder in community. The program works 5 days a week, Monday to Friday, and it is preferred if it's done over Zoom. And once again, it was launched in 2020 after the DoD program. Next slide, please. Thank you. So just kind of what Dr. Louis mentioned, the main goal of this program is to enable First Nations people and their family members to access primary health care closer to home. So the goal is always also to return care back to the community. So we will jump in, really kind of fill in the gaps wherever they're at, support the person where they're at, and then bring back all the care to the community or find those people that can be of support in community. We're not a crisis response program, but we will be able to connect you with those crisis response, if that's the case. and really to improve the access to timeless and quality care that is safe, and that it can take care of you and your family when you need to. And then this is not just a program that is for Indigenous families and communities, it's also delivered and designed so Indigenous communities are really at the center overall, and as well as like in every level. Next slide, please. Thank you. So part of that safety piece and part of like really kind of creating that cultural piece is having a beautiful, amazing group of medical office assistants that are the first point of contact with our families and with our communities. So our MOAs are so wonderful at meeting the client, the patients where they're at. They can spend between 5 minutes up to 1 hour sometimes on the phone with our patients, just ensuring that they have walked through with whatever they need to do. If they have any questions, how to access the program, connecting with the technology if they need to, really creating that safety and asking that question, what do you need to feel safe when you access the program, right? And sometimes even having that conversation, what does safety means? So we are very, very lucky that we have such a wonderful team of MOAs. And we always spend a little bit of time in these presentations just acknowledging their work, because they are such an important piece of the work that we do in creating that safety for our communities. Next slide. Thank you so much. So to talk a little bit more about the psychiatric service and virtual substance use program. So this program is virtually delivered, it's cultural safe, and we provide services such as assessment, case planning, treatment, and follow-up. We're also able to provide a little bit of longitudinal care, especially for the substance use portion. Psychiatric is a little bit more short-term. So psychiatric, we offer a one-time consultation with the patient. And sometimes the psychiatrist can offer up to, a couple of follow-up sessions, but that's completely up to the psychiatrist to decide at the time of the appointment. In terms of the substance use piece, the doctors are able to meet with the patient and create a plan to support the goal. Whatever goal you come with, we will honor that goal and we will walk alongside that journey with you. So if your goal is sobriety, we will support that goal. If your goal is to like reduce some of the substance use, they will also support that goal. So really kind of meeting everyone where they're at, and we're able to walk alongside a little bit. So there'll be a follow-up sessions, but once again, with the goal to return care back to the community. So when we are accessing, when they're accessing services with us, we are always identifying people that are in their close circle of care. So we, as care coordinators, will spend the time reaching out to the individual's community, individual's group of care, to make sure that we are providing a blanket approach. So we really step off from like the one size fits all, and we really try to individualize care, which can be a little bit challenging at times, but our program really believes in creating that blanketing and identifying people in the community that can continue supporting the work that we're doing in the pathways. And our psychiatrists are also available for specialist consultations. So if we have someone that's working with an individual in community and they have some questions, they need some guidance, they need maybe like, medication review, optimization, then they're able to access our psychiatrists as well to do those pieces. And one important thing that I forgot to mention before is that these programs are available for all Indigenous communities in British Columbia. And even if you have a family member that's not Indigenous, or you are Indigenous yourself, your family members are able to access the program. Next slide, Jon. Thank you so much. So just to give you a little bit more of an oversight between the two programs. So we have substance use on the left, and this program runs Monday to Friday from 9 a.m. to 5 p.m. And it is designed for individuals that are 12 years and older. And once again, we provide consultation, assessment, diagnosis, care, treatment planning, and follow-up. Some of our doctors support the piece of withdrawal management, access to risk mitigation treatment, as well as safer supply. They are also able to support odor induction maintenance, and then any additional care related to alcohol, substance use, and commercial tobacco concerns. So this is done, keep in mind, with having someone in community, making sure that they are supporting the work that the doctor is doing here, so that we are providing a wraparound approach. So that's really, really a key point in the care that we provide. And on the right side, you have psychiatry. So our psychiatry program works from Monday to Friday, and it's from 10 a.m. to 3 p.m. And it's meant to be delivered for individuals 60 years and older. We do have some capacity for 12 years. That really depends. We don't see things black and white. We also look at things as like gray sometimes. And with consultation, we're able to provide some of that support, just case by case. And once again, our psychiatrists provide consultation, assessment, diagnosis, care treatment, and follow-up, provide support for concurrent disorder management, and then again, once again, participation in short-term consultation care, collaboration, identifying the client's care, circle of care. And part of this is not only doing the consultation piece, the assessment, and the medication, but it's also bringing in the care coordinators to enhance some of their work, which I will talk to next. Next slide, please. So part of this care is not just kind of identifying the biological, medical diagnosis pieces, but it's like what else in the cycle of care we can look into, right? So we really believe that health is not just the lack of illness, but just, you know, mental health, as in like I prescribe and diagnose, but it's like wellness overall, right? And so the care coordinators really kind of play a role in identifying how do we enhance health? How do we make sure that this person feels supported? And how do we look at pretty much what Jon was describing at the beginning, which is like all the areas of the individual to be able to support their journey. So the care coordinators are another role that the pathways have created to enhance that safety, to enhance that cultural piece. So we help clients as well as professionals like yourselves to navigate our pathways, to navigate the mental health, but also identify things that the clients or the patients can really benefit from. So we help them to locate counseling resources. We help them to advocate for themselves. We really believe that individuals bring their own power. We don't empower them. They all have their own power. So we just let them give them the space to find that power and to use that power and to use their own voices. We support them in connecting with cultural resources, provide education about substance use, mental health. We help them connect with local physicians if that's possible. That can be very challenging, but we try. And then identify any other social determinants of health that might be impacting their overall health, and support them in connecting them with the right resources in community. The care coordinators have a background on mental health, so we are also able to provide wellness checks. So if our doctors want us to do a little bit of follow-up with the patients, we're able to do that. And part of our role is to do these webinars and this education piece so that communities and professionals are aware of our program and they know how to access and utilize it. And so with that, Jon is just going to talk a little bit more about how we integrate those cultural pieces into our program.
Thanks, Laura. So we touched on this a few times, but I really can't emphasize it enough about the first point of contact for clients as they come into the program, and that medical office assistant, the mental health care coordinators who folks are connected with right off the hop. So that warm, welcoming, empathetic, understanding voice who provides that time and space in and of itself is something that we pride ourselves on, and something that is key to the whole success of the program. So some of the other unique aspects of virtual services and how we implement cultural safety and humility, we have a safe spaces protocol, which those frontline staff walk through upon intake for clients. So clients who may identify any ways that they feel are important to ensure safety within that virtual space, we document that in the medical record system that we have, and we ensure that upon intake, we go through with the client to understand, are there any triggering words that might be, areas that the physician should know about as they step into the encounter? Are there any topics that maybe we shouldn't be exploring in your encounter? Are there ways in which we can connect you with other resources before your encounter to ensure that you feel supported coming into that? That's part of our safe spaces protocol and what we established right from the start. Once that's documented within the medical records, the physician has an opportunity before the encounter to review those notes and understand that before they step into that space. So yeah, and they review it with the client as well. I see you went over these bullet points with our medical office assistant. Is there anything more that I can do for you before we start this encounter? So that's the safe spaces protocol that we have. We also provide education opportunities around cultural safety and humility for our providers and our staff, and our community of practice meetings as well for providers. So having staff come together around this topic and understanding that it's an ongoing journey and people are at different points in that space, we really support that effort. We also have a increased accountability with our complaints or compliments process. We have an email address, quality@fnha.ca, where people are able to provide feedback either anonymously or directly to physicians or staff within the program. And we really work to ensure that we have attention to each of those emails that come in and that we're able to address them where they're at. So it doesn't matter how long, how short that email is, we really ensure that we have the time and space to review that and to enact on it and to have some follow through with that for the client's benefit. And in terms of the cultural safety aspect, many of you may know of the FNHA Cultural Safety and Humility web page. On that page, we have some resources around identifying what cultural safety and humility is, what that looks like, as well as some webinars and some videos available to review. In addition, we have 2 pledges here that provide an opportunity for folks to put that commitment or that vision forward. So it's a PDF, it's a 8.5 by 11 page that you can print off and really write down your commitment to cultural safety and humility or your vision of cultural safety and humility vision within the health system. So of course, leading by example, our staff within the program have taken those pledges and really ensure that we again lead by example with that work. And these are just our amazing MOAs and our care coordinators within the program. And so with that, we do have two more videos here to share. Dr. Louis mentioned on his video there that there's an email that goes out to clients who are in the program. And upon intake, they're given this email address. Sorry, just going to pause this. They're given an email to outline some of the details of their Zoom appointment upcoming, the time, the Zoom link. In addition, there's also this video that is provided to clients to help set the stage for the space they're about to find themselves in. So if you can envision yourself, you've just spoken to an MOA, you've confirmed your appointment for maybe Tuesday at 2 o'clock, and this video would find itself in your email. Oh, geez.
I welcome you today. In Squamish language I shared with you. I'm Sequalia Ann Wanek from the Squamish Nation, a knowledge carrier and elder advisor to the Doctor of the Day program. And I'm really honored to be able to welcome you here today to your appointment with the virtual doctor and to be able to share that you're going to be treated respectfully and properly and given that care that you need now until the time when you can go back to your family doctor, and that they will make sure and follow up during the time that they work with you, and then after share the information back to your family doctor. You need to know that they care about you and that they will do all that they can to make sure that you get what you need for your treatment, and to be able to chen stwite, stand and work together to hold each other up and help each other through this new way of being able to take care of you and your health in a good way. Tama kwetsi snachem, those are my words. Wachaya pyo, you take care.
so that video is played upon encounter arrival. And so I'm just going to play one more video, which is a patient testimonial video from Bobby White, Cinema member.
How I first found out about Doctor of the Day was through my mother. I was actually sick and I was in bed and it was probably a 2-month wait to even get a phone call. Talking virtually and online, it seemed to be a lot easier. The Doctor of the Day actually had called the hospital and arranged a lot for me as well. So they were really helpful. They went above and beyond. So it was really, really good. Made me feel really safe also. I felt like I was in a safe environment at my house too, calling, talking about my problems, and can share and express and talk about my stuff without being judged or anything like that as well. And I thought that was really good because I've had that up at the hospital a few times and it's really, really not a fun experience. So because I'm a very active guy and I'm really avid with outdoors and all my hobbies, like I do outrigger and canoe pulling and stuff like that, and I found that it was really hard for me just waiting for something as simple as like an iron deficiency. And they decided to order more stuff to kind of eliminate what it could be. So I thought that was really helpful. But they really investigated a lot more and asked more questions and how long things were going on. And they seemed to really care for me. And we were chatting for maybe about 45 minutes or so. So it was a good one. Yeah, it was a really, really good experience. The thing I liked best about the service is that it was so easy to use and it was just fast, quick, and interactive, and I'm getting my results so much faster, and it seems to help out a lot more as well because they communicate with my family doctor too. So it seems like I have a lot more care now as well with different opinions from 2 doctors too. She reassured me that she was going to be there for me as well too, which I thought was really good. The whole process of it actually kind of just blew my mind with how quick everything has gotten, and I'm just getting blood work, everything that I've needed, and it felt like I've been just dragging along and taking a long time. And yeah, I don't know, it's just a really good service. I would definitely recommend Doctor of the Day to anyone. It's just so much easier, especially if you're having issues with getting in with your family doctor or anything like that. I found that it was really, really easy. They almost did all the work for me. I just had called and they put in almost all the work and effort for me and made it seem so much easier. And it was such an easy process, and it was hard for me to figure out, you know, calling doctors, waiting for 45 minutes just to even get an answer saying you're going to be waiting 2 months to talk. And it was just such a breeze is all I can say. It was just the fact of not being so frustrated having to call here, call there, trying to get in here or whatever. Like it was just, it was easy. It was really good.
Great. So that's yeah, just a few more pieces of media to bring the focus front and center. Any more information, or if folks have any questions, obviously we'll check the chat now, but this is our information and that'll be available for anybody who wants to ask us anything directly. So yeah, appreciate the time and thank you so much for listening to the great work that we're doing.
Excellent. Jon and Laura, amazing. Thank you so much for this introduction and really innovative work. Not only the ease, the patient friendliness and be a friend, but also your commitment to cultural safety and allowing them to do that. I'm very glad that we're able to, Elder Roberta were able to stay because of technical reasons. She could only join us by phone. But I'd like to take this time to first welcome Elder Roberta, perhaps to give us a prayer, and then we'll go into the Q&A session with that. Elder Roberta, can you hear me okay?
Yes, thank you so much. And I hope you can hear me okay.
We hear you well.
Sorry about the technology on the tablet. It's brand new and children here to fix it for me. So thank you for welcoming me to stay and listen to the beautiful presentation. So I'll share a welcome and a blessing for everybody during this time today. Haichka, Siam, Siaya. Greetings and welcome everyone. As Co-Salish Matriarch and Elder, I wish to give a very warm thank you to all my relatives on the Musqueam, the Squamish, and the Tsleil-Waututh, for welcoming me to live in the unceded lands of my relatives, Musqueam and Richmond, going on 42 years now. As Coast Salish matriarch and elder, I wish to give each and every one a very warm welcome who live, work, and play, give and receive service on our unceded, ancestral, and occupied lands of my relatives, Musqueam, Squamish, Tsleil-Waututh. Always holding my hands up in honor and thanks to my beautiful mentor teaching elders, Elder Vince Stogan from Musqueam, Elder Bob George from Tsleil-Waututh, to follow in their mentoring footsteps, to always share a blessing and a prayer whenever we come together. Thank you for listening to our elders, everyone. Haichka, Haichka Osiam, Osiam. We give you many, many thanks, Creator, for bringing us all together in this wide, wide virtual circle in such a warm and respectful way. We ask, Creator, that you bless our minds, our hearts, our bodies, our spirits. So when we think our thoughts, they are good, positive, and respectful. When we speak our words, they are good, positive, and respectful. We call upon you, Creator, to bless the people who prepare the food, bless the food and drink we put in to nourish our bodies on our journeys to wellness and strength. We give you kind thanks each and every day, Creator, for the special blessings of protection you bring down upon all the beautiful people who are working so very hard in so many ways, in so many places during this pandemic, for all illnesses, for the safe delivery of our grandchildren and great-grandchildren, and especially for the ongoing opioid crisis. Continue to bless and protect them and their families, Creator. We kindly and respectfully ask you, Creator, to bring special blessings of protection down upon all our relatives right across Turtle Island who have reopened wounds and are grieving all over again over the ongoing daily media releases of this past year. Bless and protect all our relatives, Creator. We call upon you, Creator, for special blessings of protection down upon all the beautiful people and families who have experienced the extreme weather conditions of this past year, the extreme heat, the wildfires, the extreme rain, wind, and floods that took away homelands, livelihoods, livestock, pets, and beloved family members. Bless all the families and Mother Earth in this recovery, Creator. We're calling upon you, Creator, for special blessings of protection down upon all the beautiful people and families who are experiencing the oppression in the Ukraine. Bless and protect all their relatives on Turtle Island and worldwide that are mourning and grieving for their family members. And we kindly and respectfully ask you, Creator, to wrap each and every one of us here present on this call and all of our loved ones in your warmest blanket of protection as we all continue on this part of the journey of our lives together into 2022 and beyond. We always give you many, many thanks, Creator, as we ask you to bring all of your blessings down upon all the ones that are hurting, all the ones that are grieving, all the ones that are hungry, all the ones without homes, and especially, Creator, all the ones that are hurting, all the ones that are grieving. Haichka, Haichka Osiam, Osiam. Thank you so much, everyone. I pass my cedar boughs back over to you. Osiam, Osiam.
Wow. Thank you so much, Elder Roberta. Really appreciate that prayer and really calm our hearts down and really listen to each other. So thank you so much for that. I would like to jump into the questions. There are many of them, which is wonderful. Thank you so much. So Lori and I are gearing up for that. Just before I do that, I want to welcome Fiona McLeod. Fiona is, again, a First Nations Health Authority partner, a director in that program. Fiona, would you like to introduce yourself before we jump into the Q&A? And thank you so much, Fiona, already answering some of those questions on the chat already. Fiona, are you still on?
Oh, sorry, I was just having trouble unmuting myself. Thanks, Kendall. Hi, everybody. It's great to have you here. Sorry, I was a few minutes late joining today. Amazing presentation as always, John and Laura, and a huge thank you to Elder Roberta for the beautiful words and grounding us in a good way here today. My name is Fiona McLeod, and I am zooming in today from the beautiful traditional, unceded, and ancestral territories of the Syilx Nation, here in what is now known as Kelowna, where I live as an uninvited guest. And I am joining today as the the acting director of operations and planning for the FNHA primary care team. So I had the great honor of working really closely with amazing staff like Laura and Jon, and with our physicians and our MOAs and our care coordinators, and everybody else who helps make the program the success that it is today. So really happy to be here, and happy to hop in if I can help with any of the questions.
Excellent.
Thanks, Kendall.
Thank you so much, Fiona. Really appreciate it. Laurie, let me jump right over to you. I know you're all set. You look at all the questions. Laurie, let's ask away and have our expert answering those questions.
Thank you, Elder Roberta, for those beautiful grounding words. So appreciate it. Okay, so we have a whole bunch of questions, and I wanted to group a set for you guys around the coordinator. So we'll start off with, what is the definition of care coordinator, and who is considered to be a care coordinator? We'll start with that, and then there's just a couple more follow-ups.
So within the virtual services program, we have our mental health care coordinators, who are Laura, Sarah, and Elle. So as we define them, and as we provided a bit of an overview to the role in the presentation, that's how we bring them forward to this space.
Okay.
They're senior specialists within FNHA who help support clients and who help navigate the healthcare system alongside clients. So.
Excellent. So there's a question, are they nurses? They aren't nurses.
So within the care coordinator team, we have social workers and nurses in that team. So it's a well-rounded group.
Awesome. Yeah, that sounds great. Is there assistance with selecting a counselor? The list of providers looks huge, which is a good problem.
A good question. Laura, you came off.
Yeah, absolutely. Yes. So that's definitely something we can support. We acknowledge that list can be a bit overwhelming. So we will, if you are accessing the pathway and you're working with the doctor and you're needing some support, connecting with the right counselor, we will do a little bit of that work or support you with that. So we will have a conversation with you about what you're looking for. Again, safety pieces. Are you looking to connect with someone that's, trauma-informed? All of those pieces. And once we have an idea what you're looking for, we will go and look on the list. Sometimes call the counselors, make sure that they know or understand what we're looking for. And then we will send you a reduced list, about 3 to 4 contact information for the counselors, so that the patients are able to just call them directly and it's not as overwhelming.
Amazing. The last one, how do we connect patients with this care coordinator? It also looks like it came up in the chat around phone number and email. So that may have been provided there by Fiona, which is great. And probably we can highlight that in the recording as well. But if you guys have any last comments around that.
Yeah, just to note that the mental health care coordinators within the virtual services are there to support clients who are within those services. So people who have been referred in or are linked up with our services that way. It's not you. Yeah, they're not necessarily meant to be a resource that could be cold called, or somebody from without any context to just reach out to the care coordinators. But within the context of the virtual services.
Great, excellent. Thank you, Laurie, and thanks for all the questions. Keep them coming. Please keep typing. Laurie and I will keep looking at those screens and ask. Jon and Laura, the next question is about the actual services themselves. I got about 2 of them. One is, do you have integration of the virtual services with the local services that's available? How do you, for example, when a person calls in, do you connect with the local services, and how do you offer your services virtually? What are your thoughts there?
That's great. Thanks, Kendall. I think, so within our medical record system, we do have linkages to pharmacies within BC, obviously, and the local health centers in each community. and what those resources look like. So we do have a bit of a directory or area of those types of services. Now, in terms of the physicians within the program, the Doctor of the Day program is structured. Of course, services are provided provincially, but the scheduling and the linking up with clients is done regionally, if that makes sense. So for an Island Health doctor, they would be on shift for Vancouver Island Health Authority, and they would help identify some of those resources within the health authority and how they can navigate that. So a lot of our docs have familiarity in remote communities, rural communities, city centers. But our medical record system and the doctors who we have within the program are good resources to pull on that.
Excellent, thank you. The next question, perhaps Laura, is about the substance use and psychiatry line. Do the physicians or the health professionals screen for commercial tobacco use and provide brief intervention and perhaps other kinds of screening and interventions? Could you maybe go a little bit deeper there?
So I don't know if I can answer that question exactly how, like, you want, like, as detailed, but I know that wherever goal the patient comes in, the doctor will be able to support that. And really, there is an education piece about commercial tobacco versus the medicine. So I think it's important to they will spend some time kind of having those conversations and acknowledging that tobacco is to be honored. And then there is an important medicine in the culture and the community. So in terms of the assessments or the screening pieces, I am not sure how that works. But whatever the client brings into the session, or into the consultation, that's where the doctor is going to be able to work with. We also have a department that focuses on educating about the tobacco, and so anything that we need to be able to learn or connect the patient with, we will access that department.
Excellent. Laura, I'm going to interpret that question a little bit. And Laurie, thanks for asking a question. If I didn't quite get to it, please type in other further comments. Sometimes screening meant that, even if the client doesn't ask for it, that one would proactively ask those questions. Do you do screening for tobacco use? Meaning if the patient doesn't bring that in to the conversation, would there still be that consideration?
I probably will defer that to Jon or Fiona, because that would be, I'm thinking that part of the screening, we're screening, we're assessing overall health and presentation, right? So it would be mental, physically, emotionally, and spiritual health. And so one of the questions would be like, substance use, and it would be to assess what types of substance are you consuming, if you are, and commercial tobacco would be one of them. I do think that our doctors are very comprehensive and they do an amazing job at assessing all of the aspects of health. So I do think there will be a screening for it, but maybe Jon or Fiona have.
I just put a link in the chat there for our FNHA Respect Tobacco program with some resources there that our docs usually utilize around vaping, e-cigarettes, secondhand smoke. That might answer some of your questions there.
Excellent, thank you. Laurie, back to you.
Can you tell us what feedback there has been in terms of comfort level of using the virtual technology amongst the different age groups and Zoom platforms, if you've had any feedback?
So I wouldn't get into specifics around age groups. What I would say is, we work alongside clients with their comfortability. So if a client wishes to just have a phone call, they can just have a phone call and we can work with that. If there's preference for, like on the substance use and psychiatry side of things, if there's preference for a video feed, our MOAs and our care coordinator staff are well positioned to support them. And if it means linking up with a family member to support, or a local resource, or a local telehealth codec that might maybe in community, we work alongside them to make sure that they have what they need to get into that appointment.
And then just the follow-up, and you've kind of touched on this a little bit, but how do you think the barrier of access to technology can be addressed? people maybe that don't have access to technology?
It's a good question. So we have and Fiona may be able to allude to this, but within FNHA we had a tablet initiative where Samsung tablets were provided to those who didn't have access to any video services or technology of that account. So we did work alongside some other partner organizations to ensure we can get those out to the friendship centers and to communities, and even directly from our care coordinators if need be. So that was a pilot program, and I think it's being reintroduced next year, but I don't want to speak out of turn, but it's definitely on our radar.
I want to just take a quick pause. Really want to thank those who may need to leave by 1 o'clock. Again, thank you so much for being with us. This session will go to 1:30. So for those who want to stay, please continue to stay so. And for those who may need to leave, thank you so much for sharing the space and sharing your thoughts with us. And really appreciate that. Maybe Jon and Laura, could you give a general sense about the average turnaround time for the patients from the initial call to the appointments, and how they triaged, and also if they do investigation or something and the patients don't have family doctors, how do they follow up, or how they refer to a family doctor for the labs? Maybe walk us through a little bit about that mechanics.
That's great, thanks. Yeah, so our physicians are positioned to bring information back to the family doctor or the community nurse if that's what's requested as well. So the sequencing there is a patient may have an encounter, blood work is ordered, or some results are requested, and so that information it's in the encounter where the doctor will identify where that information can go. If it's back to the current doctor who's seeing that client, if they don't have a family doctor, then that's what we do. But our MOAs are positioned to help, again, identify some of those resources in community. So if it's a telehealth codec that somebody could loop back with alongside a nurse practitioner, or if it's a preparation of the chart and information that's compiled to be sent back out to the provider, we work with the client and the community if need be to get that over.
Excellent. And I may have missed this from a client calling in to coordinator, triage to appointment to finish, what's the average time duration?
So if you were to call in today, if somebody called in today, they would expect maybe a 4.5-day wait. So we'd be looking into early next week to get in with a physician for a half-hour appointment.
Got it. Thanks. Lori?
So this is around, so we know there are significant barriers to safe supply in rural and remote communities. And it looks like you provide OHE through mental health and substance use virtual care. Is there also prescribing a safe supply to people who are actively seizing? And then there'll be a follow-up question after that.
I might defer to Fiona on this one. We do have a safe prescribing guideline that physicians follow, but you came off.
Thanks, Jon. I can provide a little bit of context for that one, and maybe Laura jump in if need be. I did miss the part about I did miss the last part of the question, but I'll start with just talking a little bit about the safe supply. So yes, we do offer prescription for safe supply and risk mitigation therapy. It is with within the regular physician standards on prescription of that treatment modality, and as much as possible, it's with very close connection with local resources who can help support that person who is getting the treatment. The preference is always that there's local resources involved to provide a circle of care for that person who's seeking that treatment. We do have also a prescription of controlled substances guideline that we do follow as well. We need to be really, obviously we need to have a really good eye into safety as a virtual service, knowing that we're not actually on site, being able to work with somebody in person and do that in-person assessment. So we do have some guidelines around the types of controlled substances and the situations in which we will prescribe. And so maybe I'll just, I don't know, do you have anything to add to that, Laura, from?
Yeah, no, just kind of building on that, Fiona. So there's very specific parameters to prescribe controlled substances, and this is followed by all doctors. Some of them do feel a little bit more comfortable working within this area, and usually those doctors really explore the relationships within community. So they have established longitudinal relationship, not only with the patient, but also with the community. So for example, we will connect with the health center nursing team and make sure that they know that we are doing this type of work. So by no means we will just kind of send a prescription and see you later, but it will be like some follow-up and making sure that someone on the ground is supporting that work. And then there is this blanketing approach, specifically when it comes to narcotic or pre-medications.
Thank you, that was very helpful. And what was the strategy for reaching out to that rural remote group where we know that there are sometimes challenges with access to this type of care for sure?
I think that's when the care coordinators really jump in and they have the time, the luxury of spending some time building that relationship and explaining the need and the support that is needed. Because if we don't have that relationship, there is no way that we can provide that support that the patient needs in community. So we will spend some time creating and building those relationships so that we know who to go with or who to go to if there is something that comes up or the patient needs, or to make sure that they're supported in the way they need to. So once we identify the circle of care, then we can refer back to them.
Great. 2 questions. By the way, thank you so much. Those are excellent answers and also excellent questions from the audience. One question is, can a patient self-refer for the substance use and psychiatry line?
So that I saw another question in the chat there around referrals. So the program is structured so that there is no self-referral into the substance use and psychiatry side. There would be a referral in by somebody who's able to walk alongside that client and support that client with some of the resources or some of the follow-up that's required. So Laura alluded to it, but nurses, physicians in community, other practitioners in community for sure, even family members or elders in community, respected community members will refer as well. And so the idea is that that person would be an advocate for that person's health and be able to loop back and support them as we're moving forward.
Got it. Thank you. A second question is, would the doctors or the day service or the psychiatry service do some advocacy work? For example, if a patient has a family doctor but feel that there's some communication issues with family doctors and access this line, would the virtual line help that person advocate with their family doctors?
Yes, Laura, you came off mute. Go ahead. Yeah.
Absolutely. So that's really a big part of the work that we do. It's to advocate and make sure that we're able to support the navigation of the systems. So as Jon mentioned before, some of us have a background in social work as well. So we understand kind of navigating the system from a social justice lens. And we have advocated with, let's say, clinicians, CYMH clinicians, where we know that they need to kind of step in a little bit more or do what they need to do, understanding people's, the area of work and their mandate and all of those pieces. We have an understanding as care coordinators of what it needs to happen with a certain patient or how they need to be supported by the community members, by the agencies that are supporting it. So we will use our voices and we will create space, not to speak on behalf of the individual, but to really kind of support them in speaking up for themselves and understanding their rights and understanding how they need to be served and supported by those communities. So yes, there's definitely ongoing advocacy efforts from our end.
Excellent. Laurie?
Yeah, this is actually a personal question. I noticed in the PowerPoint, the doctor of the day had said more services in mental health and substance use were needed. I was curious what those services were and how FNHA was sort of advocating for those services.
I think the slide that you're referring to was in the early days of Doctor of the Day, where we identified that more mental health and substance use services were required. So we started the substance use and psychiatry clinic. So that's where, I think that's where that was coming.
Another question coming about pediatric populations. Does your substance use psychiatry services or Doctor of the Day serve the pediatric population?
I'll speak for virtual substance use and psychiatric. So, you know, there are many more services available for individuals between the ages of 0 to 19. And we know that, for example, Child and Mental Health with the ministry takes care of the mental health of youth and children. So we needed to create a service that understood the gaps and also supported individuals that were kind of like out of the scope once they turn 18. So that's why we prioritize 16 and plus. But like we mentioned before, there will always be capacity and there will always be opportunities to support younger folks. With DOD, I think it's every age, if I'm correct. But with virtual substance use, like we really kind of came from a place of this is what's available in community. There is way more services for young people. And so instead of kind of like jumping in and taking care of that, let's work with CYMH, or other services out there, and let's fill in the gaps where it's mostly needed.
Excellent, thank you. Laurie?
Yeah, a good question came up. What education or training resources does your team utilize for trauma-informed practice?
Thanks, Laurie. I think us being a virtual clinic and being stood up in the way that it did, we leaned heavily on our communities and our resources within FNHA to help identify, some physicians and some providers in community who have been held up and really ensured their commitment to that journey of trauma-informed and culturally safe practice. So we have a community of practice with our physicians, and where we share resources and we're able to learn from one another and include elders and traditional teachings in that regard. So recognizing it's an ongoing journey, it's something that we're able to tailor for each sort of group of physicians and move forward along.
This is my question, and I don't think I've seen any more questions. I'll go through that again, so make sure I don't miss anybody else's question. In the meantime, I'm interested in your thoughts. I'm very glad you're all very, very committed to cultural safety. Do you see what are some of the issues about cultural safety on the virtual field that we perhaps need to pay even more attention to compared to face-to-face care? Are there certain instances in the virtual environment where you say it's easily missing on the cultural safety piece, so we take extra step to do this, or we need to pay attention to? Welcome your thoughts.
That's a good question, Kendall. I think what we like with the providers who we do have, it's interesting how I'm showing up to you virtually within a box. The lighting, the way my background is framed, the way I present myself, introduce myself, acknowledge the territory, all of that sort of plays into building rapport and ensuring that safety or that shared understanding with the client. And so what we do is we work with our physicians, and including our provider meetings or our community of practices, just to recognize like that's something that's important. That's something that helps build that rapport. So some physicians may have Indigenous art in the background. Some may acknowledge the territory upon the start of the encounter. Some may carve out specific time to lay out their background, their lineage before starting with an encounter. So at the provider's comfortability, but really those are just some ways that those are being implemented in a virtual space.
Mm-hmm. Excellent, John. Laura, any additional insights?
Yeah, I think something that maybe we have identified as a little bit more challenging and doing a little bit more work is that sometimes people cannot afford the confidentiality fees, right? Sometimes we have a large number of family members living with us, and maybe it's hard for us to kind of find a little space to have that time with our doctor, with the coordinator, with the psychiatrist. And so really spending some time kind of working alongside, and we've done some of this work where we will work with the community center and have someone allow them to come in and then, you know, have the iPad and then, you know, provide them with some tea, so that they have that space, because we assume that, you know, because you're from your home, then you can kind of have that piece of like safety and confidentiality and all of that. So just really kind of knowing like, okay, yes, we're home and we're virtual, but really kind of taking those extra steps to make sure that it's always safe, and then they have the space to create that. But other than that, we all come from a place of really understanding that we're trying to do things differently, that we are showing up for our families the best way that we need to, and that safety can look so different for everyone, right? And so it's very subjective, and so everyone shows up in a different way, and it's very individualized.
Excellent. Thank you. Fiona, any additional comments or thoughts on that?
Oh, nothing additional from me. Thanks, Kendall. Great answer, Laura.
Thank you. Laurie?
No more questions, but that was great. What a wonderful service to be able to reach so many people in their communities, which I think is so important. So thank you.
Absolutely. I see one recent question is, can the patient see a traditional healer through this service? What do you think?
So our the care coordinators are well positioned to link up with some traditional healers within community, and whether that be a virtual space or a in-person space, that's something. Within the program specifically, though, like in terms of scheduling something and booking an appointment with one, that's not as. Oh, and Fiona's already answered that in the chat.
Oh yeah,
there,
Fiona.
Yeah.
I missed that. Sorry.
Yep.
All right. And Tessie just asked the question: is the demand increasing over time for these services, and if so, is there ability to increase resource capacity to meet those needs? I think you partially answered that in asking for additional resources. Are you seeing the demand increasing, and how fast is the demand increasing? What's your sense?
Yeah, certainly. I mean, Bobby White there on the patient testimonial video said, I called in the morning and I got a booking same day. Those days are long gone now. We're seeing a bit of a wait list for the program. And so, like I said, about 4.5 days for the Doctor of the Day program. And so there's always, I think, yeah, as great as we are to position ourselves within this, I think the demand is always going to outweigh the ability for us to meet that. And we're doing our best with what we have. And what I will say is part of our recruitment and retention process here is really ensuring that safety of those physicians who are involved with our program. So yeah, that's one thing to note there as well.
Excellent. And do you while on the wait list part for the psychiatry and substance use, what's the wait for that? I think Doctor of the Day is at 4.5 days, right?
Doctor of the Day, 4.5 days, about 2 weeks for addictions and 6 weeks for psychiatry.
Okay, thank you. Do you track the usage of these services to help identify specific gaps in services?
Yeah, so we have a dashboard that's created with our medical record system to help give us pretty much real-time information on utilization, service times, all of that information. So we have our team who review that quarterly, and I can see it daily or usually monthly.
Gotcha. Excellent. That's all the questions I've been able to pick up. Laurie, have I missed any others, or have you picked up any additional ones we haven't asked so far?
No, I think you got them all from what I can see.
Okay. All right. I think maybe I will just talk for about 10 seconds. If there's any additional questions, please send them in. I always believe if if a round come to a natural end, we'll end it. We don't need to hang on till 1:30. But obviously, if there's additional questions you want to ask, please type them in at this particular time. But it's just it strikes me is service. And I'm very glad Jon and Laura and Fiona, you allowed us to be able to feature this in today's rounds. And it's not only innovative, it's not only patient friendly, it's not only culturally safe with commitment, but really demonstrate how you working in integrating with the different resources in the communities in the province, working with different health authorities and different groups, so that we can provide the best care we can for our patients, to really care for them and care with them. And so I really want to thank you very much for that. It's amazing participation for everyone in your questions. Thank you so much. Thank our speakers. Really appreciate the time, the thought that you put into this presentation, but really the thought since April 2020. To set this innovative service up. I can't think of another province that has this available. You may know, but I don't know. And I think this is such a unique and very useful and important service at this time with COVID and well beyond COVID. So really congratulations to you all for that. Before I end, perhaps I'll pass it to our partner, Laurie, if you have any closing remarks that you may have before we officially close the round.
No, I think I just would repeat that I think this is such a great way for Indigenous patients and families to have access to care, especially in some of our rural remote areas. I think it's really important, and starting to build those networks and build that trust in our health systems is just so vital to transforming healthcare today. So thank you for all the work you guys have done in that.
So thank you very much, everyone. This will become a recording. So if you have friends or colleagues you think will benefit from it, please do refer to our ICON website, the Indigenous section, so that you can access it, and also can be accessible through the VCH Indigenous Health area, so that you can find this particular information. If you can't, please email me or iconproject.org. We'd be very happy. And with that, thank you so much, everyone. Have a happy Friday, wonderful weekend. And again, thank you so much for sharing this space with us for today. Bye, everyone.